Hi, I'm Imogen Blood, and in this, the fourth episode of my Change Talk podcast, I'm going to be interviewing Professor Nicholas Pleace of the University of York on the topic of housing first, a topic that he and I have researched together over the last 8 years. Housing First is a service response to people who have typically long-term homelessness alongside multiple and compound needs, usually mental health, issues with addiction, maybe a range of other support needs. And the Housing First model aims to settle somebody into long-term housing, into an ordinary tenancy as quickly as possible, and provide the wraparound support that that person needs for as long as they need it in order to sustain that tenancy. In this podcast, Nicholas fills us in on the background of Housing First, its origins in the United States, and draws learning and comparison from the way in which it's been implemented in different countries. And we reflect together on how it's been implemented in the English context, on the impact of the housing crisis and austerity, localism, the impact that's had on local authority commissioning, and of course, extremely overstretched mental health and other services. So we reflect on the impact that's had on the development of Housing First within England. And Nicholas then makes the case for a national strategy for Housing First to give the model the investment and the strategic clarity that it needs, with a focus on prevention and on multi-agency coordination so that we really get the best strategically out of the Housing First model in this country. I hope you enjoy the conversation. Thanks so much for listening. Great. So I'm absolutely delighted on this, which is the fourth episode of my Change Talk podcast, to welcome today Nicholas Pleace, who's been a long-standing collaborator. I'm not even going to try and tot up the years we've been working together on Housing First matters, but it's been a while, hasn't it?
Yeah.
Nicholas, I just wondered whether we could start off by just giving us a little bit of a potted history of your work life, just so our listeners get a sense, if they haven't heard of you before, of where you're coming from.
Yes, so I started doing housing related research back in 1991 when I joined the Centre for Housing Policy, as it then was at the University of York. And I started off as a researcher and eventually ended up directing the centre until it took on another form in 2024. So kind of the first thing I did was mid-90s, 94, 95, where I did a project funded by the Joseph Rowntree Foundation. And that was the first time I got into this stuff because that came out of an analysis of why lone adults who were being placed, found statutory homeless and placed in council housing, and it was mainly council housing back then, why their tenancies were collapsing and what local authorities were doing about it. And it was kind of it's fairly early on in the history of kind of floating support models. So hostels and supported housing, particularly big old-fashioned hostels, were starting to fall out of favour and being replaced. But the process of resettling people from those hostels and dealing with the support needs and other needs of lone adults as they came out the other end of the statutory system and went into housing hadn't been worked out yet. So what local authorities were doing was using their housing revenue accounts to hack together services that had some resonance with Housing First, but were much, much lighter touch and had much bigger client load. So it was the first thing I did on that. And then bits and pieces on supported housing. I mean, the first real work on Housing First started back in about 2008 when I did an evidence review for the Scottish Government that was on effective interventions for addiction around homelessness. And although Housing First had been around since the 90s in the States, the kind of literature is only starting to permeate through at that point and reach European, UK, and other audiences. And that report prompted one of the first projects, which was an experiment in Glasgow, and it also prompted SHP in London to have a go at the first Housing First service in London. And we did a small evaluation of that. And then there was a series of projects with Homeless Link and with others really up until, I mean, the most recent one we finished last year, looking at individual housing first services and programs. And then the other stream of my work started in 2010 when I started to work with the European Observatory on Homelessness for Fienza, the European Federation of Homelessness Organisations. And I'm still working with them now. I mean, with them and the Housing First Hub Europe, I worked on the European level guidance for Housing First, which did involve Sam Decemberus and the various kind of policy leads from a lot of European countries. That's a pretty substantial document that tried to bring together the kind of difficulties of simply moving housing first into a European context and tried to allow for the kind of differences between European countries in what that meant. I mean, the shorthand for that stuff was that when housing first was developed in the States, access to medical services, to adult, what we now call adult social care, but social services, social work, was pretty restricted, and the benefit system was very restricted. So housing first in the States had to be a lot more self-contained. And European contexts were quite different because there were a lot more publicly available universal services. So it meant reformatting it so that it became more case management led. And then, since then I've been doing more of the same stuff. I mean, since about 2019, I've become a bit less research active because I've been doing leadership stuff in the university. So I don't do quite as much as I used to. But I've kept on with Fienza and I've kept on with the Housing First work.
Yeah, absolutely. And so, gosh, I mean, it's like, almost 20 years, isn't it, of housing first research, if I'm just doing my maths right there, that you've been involved in this country.
Yeah, it's getting on for that.
Yeah, it's quite a while, isn't it? And I'm just gonna slightly rewind us for anybody who's watching this who isn't really immersed in the housing first model. I mean, obviously it's been in the news quite a lot, and I think people, more and more kind of people have heard of the model. But for anyone who isn't really kind of up to speed with it, hasn't had direct involvement, can you just give us a little bit of a summary of what housing first even is?
So I mean, the very, very shorthand is you go from a model that tries to make people housing ready. So you go from a model where, more or less in contemporary terms, you have an outreach team that finds people, or you have a referral system that finds people at risk of homelessness. And it's particularly focused on people with multiple and complex needs. That's what Housing First is designed to do and to work with. Our old approach used to be to try and modify behaviour. So it was framed in terms of making somebody housing ready. So you would go into a service and the service would ideally get you to a point where you could move out and live more or less independently. There were systems that would follow you out and give you a bit of light support if you needed it. And those systems were not disastrous, but they didn't work very well. They didn't work very well, particularly with people with very high and complex needs. And so what Housing First did was what it says on the tin. I mean, it gave people housing more or less immediately. And rather than trying to kind of train them and alter behaviour and make sure treatment needs were met, it put in a case management system. So, a kind of service broker model where there's a key worker and the key worker connects you up to all the stuff that you need. And then there's a few kind of distinct things about it that are important. So, I mean, it separated housing and support. So you've got your tenancy, you've got your housing, and if you at some point stopped engaging with the support service, it wasn't tied to the housing. So you got housed and you kept the housing even if you stopped working with Housing First. It's a much more intensive model than earlier models of kind of floating support or supported housing. So, an earlier model of using mobile people to support people in their own homes, they might have a caseload of 15, 20, 30, 40 people. With Housing First, it might be 5 or 6, and often no more than that, and that sort of things. The other crucial thing is that it's a consumer choice or co-produced model, so that you work with people. You work together with your Housing First worker to decide what kind of support you need, and it allows you not to do some things. Most controversially, not so much in the UK, but in some other countries, the choice to continue to drink and the choice to continue to use drugs. Now, I mean, Housing First tries to steer you away from that. It's an active intervention in that sense. But it does give you a lot more choice and control. And the outcomes of this approach, so going from behaviour-led responses that tried to make people housing ready to a housing-led response where you're trying to support people to stay in housing, that seems to work better with people with multiple and complex needs. I mean, early on, it all got a bit messianic and everybody was saying we've now solved homelessness because Housing First was a lot more effective, particularly in some of the American models it was being compared to. Its origins were in the US. It's not 100%, and no service is, but in terms of a better way to respond to repeated and sustained homelessness, it's been something of a breakthrough, and it's had a global impact.
I'm just thinking a little bit about, I mean, there's obviously we're interested in this podcast to change a number of different levels, and there's some really interesting reflections I think that just like to sort of tease out really around individual change, but also around kind of system change in what you've just described. So thinking first of all about some of those individuals, why? So it may seem like an obvious question, but why is it, do you think, that putting that housing in place first and having that case management system, why does that improve the chances of success really? Or do our idea of what success even is shift? I mean, just how does that kind of work for individuals, do you think? What are the advantages there?
I mean, one of the things is that there's this very significant kind of cultural shift and a shift away from sort of mass media, cultural, social media images of what homelessness is and what people experiencing homelessness are like. Because the earlier service models were framed in terms of treatment and behavioral correction. So Teresa Gowan, an American academic, talks about this in terms of saying, well, there are kind of three ways to understand homelessness. And those three ways are sin, and for sin, read addiction, sickness, and for sickness, read mental health, and systems, which is systemic causes and issues about the way in which systems work, the way in which society works, that exacerbate the chances of homelessness and mean that certain people are at heightened risk of it and will experience it because of the way everything works. So what Housing First did in terms of individual experience was it was posited on the idea of housing as a human right. That's one of the kind of core principles of the approach. And it saw the human being and tried to see the human being. So that was a fundamental change. So you shifted from basically kind of thou shalt not models that were designed to regulate behavior, ensure treatment compliance, and ensure that somebody was, again, this kind of idea of housing ready, and instead started to say, you're a person, your opinions, your viewpoint, your experience matter. And we're going to talk to you about what you need and work with you about what you need. So it was a kind of humanization of homelessness in terms of the response to homelessness. In terms of the response to homelessness, that didn't make a lot of sense, but it saw the human being for the first time. That happened a lot later with homelessness than it did with, say, adult social care and health services, where you see more and more focus on the individual, listening to the individual, working with the more patient involvement, more patient-led approaches appear much earlier than they do in homelessness. So to some extent, it kind of mirrors the
Mm.
changes around things like adult social care and health services that had started happening anyway. So that's a big individual change.
Yeah.
I mean the systems level change, I suppose, to move
Mm.
on to that. Um, there not really been something this effective for people with multiple and complex needs before. So
Mm.
you're always talking about limitations, problems, how to modify systems without there being a kind of, you constantly were pointing out that things weren't working properly and not necessarily getting to a point where you could actually say, we should do this.
Yes.
And that answered that question to a considerable degree.
Mm.
So, and you know, part of the system change, part of the reason why governments picked this up. So it's picked up by the George W. Bush administration in the States, first of all, and you know they weren't particularly liberal-minded
Yeah.
in the American sense or social democratically minded, and it was sold on cost effectiveness.
Mm.
And you know there's a sort of urban legend that was actually based on fact of this of an individual in the States called Million Dollar Murray, and it's a famous article in the New Yorker. And Murray wasn't actually his name, but Murray had a lifetime of street homelessness and frequent contact with addiction, criminal justice, and other services,
Mm.
and died on the street. And when it was backtracked as to what the engagement with the state had cost, you know, how much public expenditure had gone on to Murray, it was nearly $1 million
Yeah.
with no, you know, with no resolution to the homelessness, no way out of it.
Yeah.
And that kind of that image of a high cost, high risk individual who, you know, in British terms is they're in A&E 50 times a year, they get arrested 40 times a year, they're in and out of homelessness services, and or they get stuck in what's supposed to be a temporary service forever at a high cost.
Mm.
Be able to say in a political administrative sense, we can now do something about this.
Mm.
And there is an intervention that will not necessarily be hugely cheap, but will provide a resolution and will make this person less expensive, less resource in consuming in terms of emergency services. So that was very powerful. So there's a political administrative change attached to it because there's this kind of cost effectiveness argument that can be attached to it. And the other thing I suppose around systems change is it kind of, I mean, there's a lot of emphasis, some of which is, I would probably say, is a bit misguided on evidence-based interventions around homelessness. But this was one of the first iterations of that. So it's the first example I can think of where somebody ran a randomized control trial comparing Housing First with existing services, which happened to a small extent in the States, but happened at a bigger scale in Canada and France, and which kind of provided clinical level evidence around that. Now, there's all kinds of problems and limitations because randomized control trials are kind of, does the pill work or not, which is quite simple. And the problem with something like Housing First is because it's attuned to and to some extent bespoke to each individual, the intervention's not consistent in the same way. So it's a slightly difficult thing to do in terms of switching those methodologies across. My own experience is that, you know, if you talk to people who use Housing First, it's transformative and produces systems change for people who experience using it, you know, and big significant changes. So when they compare and contrast what their experience is with Housing First compared to earlier and different models of homeless service, very often Housing First comes out as being a better alternative, as something that's been a more positive experience for them. I mean, all the narrative around what Housing First does needs to be set in context. So you're intervening with populations who've got high, multiple, and complex needs. So putting somebody into a Housing First program or service, they're not suddenly going to get better in 3 or 6 months.
Yeah.
And some of the work that you and I have done on Housing First shows that sometimes it's functioning as a palliative service, but people are still in a better state than they would have been in existing services. So those are the kinds of changes I'd highlight. I suppose the other quick one would be it shifted the narrative to something positive and possible for the first time. We were just tracking homelessness getting worse and worse. And there wasn't really a clear narrative. So I think that's a big change as well.
Yeah, absolutely. And to have something of a roadmap of how we can, work with this particularly excluded group of individuals has been, quite revolutionary for the sector. Just before we get on to reflecting on Housing First in the UK, you touched, obviously mentioned a few times its kind of roots within the US, and I think you briefly mentioned, made a passing reference to Sam Tamberis. So I wonder if you could just give a little flavour of how it all kind of began, because and again we've got quite different systems at quite different stages of development in the US and the UK. We'll come to the UK in a moment, but just to kind of just join up that dot really around its roots in the US would be really helpful.
Yeah, so it's much older than most people realise. So we're talking 1991, 92 for the first experiments. And it comes from a discharge from psychiatric hospitals. So what used to happen with US psychiatric hospitals was you would be released into what was called a linear residential treatment model, what we call a staircase model. In some instances, literally moving from one service to another as part of a process of discharge from hospital. So you come out of hospital, this is the kind of extreme. You come out of hospital and you go to something that wasn't a million miles from a ward, and you go to something that was a bit more home-like, and you go to something that was a bit more home-like still, and then there'd be a final stage, which was you're more or less living independently in a housing-like environment, and then eventually again you're housing ready and you go out and you can manage. And it went wrong almost immediately. It went wrong because the way in which they operated was they had quite strict regimes within them. So zero tolerance of drugs and alcohol, all kinds of behavioural rules. So people would get into this kind of first stage or second stage and then break the rules and get kicked out. Or they'd run away, which was a frequent thing because it's a horrible environment, and people don't like horrible environments. So they'd get their, they'd be allowed out for the day and they wouldn't come back. And the other thing was that they would just get stuck. So you'd have to kind of get over a hurdle between, the more clinical stage and the more housing-like stage, and people wouldn't do it, wouldn't be able to do it because their needs were multiple and complex. It was framed in terms of you've got to change. You've got to change. You've got to be a different person to stop you being somebody who's going to go back into a psychiatric hospital. And the homeless sector in the States copied it. And surprisingly, what didn't work for discharging psychiatric patients also didn't work for responding to people who are homeless with multiple and complex needs. I mean, partly because there was very often a host of other stuff alongside a diagnosis or a mental health problem. So it was imposing something that was designed for mental health onto a different kind of problem. And so it really came from modifications to psychiatric discharge services, which said, right, that's not working. As we're closing down our long-stay psychiatric hospitals, we're going to see about putting people straight into housing with a multidisciplinary support team and case management. And Sam Tamberis saw that and looked at what was happening in homelessness and said, wait a minute, we can transfer this idea across to homelessness services. And while we do that, we tune it so it's actually about homelessness. So you go, okay, well, that's a good basic model. Put them straight into a house with the support system they need. But we look hard at that support system and say, well, actually, you know, what do we need to do to modify that to make sure it's working for people who are homeless? And it got picked up by New York. It got picked up, crucially at federal level, and it kind of started to roll out from there. I mean, I think the crucial thing for Europe and for the UK was Finland. From about 2008 onwards, confusingly about Finland, because Finland said we've got a housing first strategy, and they were attacking a bit of a residual social problem. You know, it wasn't a massive Finnish homelessness population because they've got a very extensive welfare state and social housing and that kind of stuff. But they did have a problem of long-term homelessness associated with multiple and complex needs. And they revamped everything towards what they called a housing first approach. The confusing thing, I did do work for the Finnish government reviewing their strategy back in 14-15, was that it wasn't the same as the American thing. It was very similar, but what it was a housing-led strategy. So it took the kind of core ethos. Took is the wrong word because the Finns got here independently. They didn't read the American stuff and then say, let's copy that. They got to the same place from their own experience and their own data, and started to replace all their big hostels with apartment blocks and with scattered housing, with floating support, with intensive floating support and a mix of other services. Very different because it was a national strategy. It had a lot of prevention in it. It had a mix of services, some of which looked like Housing First, but there was a range of other stuff. And crucially, it had a dedicated social housing supply, because using cunning Nordic logic, the Finns realised that if people didn't have houses, you probably had to address that as part of a comprehensive strategy. So there was building going on. There was actual development of social housing just for the homeless population, which would then combine with these services. That's what really picked it up in Europe and in the UK as well. Was this suddenly there's this example, and the Finns are by about 22, 23 looking like they might eradicate long-term and repeat homelessness. So that was a lot of momentum came out of that.
Amazing, isn't it? Amazing. And so thinking about the UK context, really interesting to hear all that history actually in one kind of story. Obviously, on the one hand, quite different sort of nature of our existing homelessness services. You know, we already have and had and, you know, continue to have some, you know, in many ways, very high quality supported housing services. So quite different in some ways to the US. But certainly, unlike the Finns, you know, we haven't quite yet. We may be on the brink of it, but, you know, optimistically, but we haven't yet kind of recognised, you know, the need to really develop huge amounts of social housing to accompany our kind of housing first ambitions. And so it's kind of landed in a very different context. How did you, I mean, you touched on those very early stage schemes in Scotland, and you know, then of course SHP down in London is one of those early providers. How did it sort of come over here, and how did it then take shape and, you know, become the kind of movement that it did from your perspective?
I mean, really haphazard, to be honest.
Mhm.
Government was very late to engaging with the idea, particularly in England. It was more progress in Scotland, Wales, and Northern Ireland in terms of looking at the idea strategically. It's arguable that government in England still hasn't actually done that. I mean, it's kind of been endorsing the idea under the previous Conservative administration and under the current government as well. So a lot depended on the homeless sector, which initially was Homeless Link and Housing First England, really promoting the idea. So it was the sector itself saying, this looks like it's going to be more effective. We should look at this. We should do this, because we think if you're going to commission us to provide services, this is going to be more efficient. So it's actually the homeless sector that makes a lot of the running in the UK. And it picks up and uses research evidence and academic evidence as part of making that argument. But spends, I mean, so Housing First England and Homeless Link and the people there spend a lot of time selling the idea. They're going around having, I mean, I went to some of these things, they're going around having regional meetings, talking to homeless service providers, talking to local authorities, and having the same conversation with local authorities multiple times, which is something I didn't mention, is that, you know, ideally it's supposed to be an open-ended model.
Yes.
And then in the local authority contracting culture that you and I have looked at, that's a very hard and difficult sell. So, you know, we'd say to a local authority, well, the support's there for as long as they need. And back then the local authority commissioners would say,
How long is that?
How long is that?
Should we say 2 years then? Yeah.
So I mean, so that kind of so a lot of it came out of the sector pushing for it, and then when it landed in a very different context. So the stuff that you and I have looked at in terms of commissioning environments, and we've looked at, you know, we did the Merseyside project when we were looking at the potential development of housing first, and then you did stuff with crisis, and there were other people around, kind of what the model should look like. I mean, huge difference. It was definitely just a lot less money.
Yeah.
And the money was a lot less a lot less certain than it was in other contexts. So, you know, the length of contract, amount of money that's available. So you're very often trying to pull together services with very limited resources compared to what the original model in the States would have cost. And, you know, I mean, when the French imported Housing First and did a randomized control trial on it, and they copied across the kind of we should plug our Fidelity framework, but our Housing First Fidelity framework goes into this, that you and I and Anita have worked on. You know, there's intensive case management and there's assertive community treatment, and assertive community treatment is a kind of step up for the most multiple and complex needs, and it's an integrated multidisciplinary team that's part of the service, that's baked into the service. There's no way there's the money to do that in the UK, you know. So one thing is it immediately gets cut down to an intensive case management model, and then it really probably gets cut down a bit more from that, so that in practice what you get is the stuff that's been done already on floating support services, resettlement services, whatever you're going to call them. So, you know, the existing models, and the client load is no longer 25 or 30, it's now 6 or 7, but it's the same people doing the same stuff. They're just there for a lot, you know, a lot more time for each individual that they're working with. And you have to adapt, you know, because, you know, still in the States, there's not universal healthcare, there's not universal access to things like addiction services, to adult social care. So there's also an argument that it kind of doesn't make sense to try and roll out the full fat act version of it, because there's stuff there to refer people to. And even in the context of the UK, once you're in a big city, there's specialist NHS homelessness services that include things like mental health teams and addiction services that you can connect people with. So it's a very different context. The other difference, of course, is you've got some social housing. I mean, a lot less than it used to be. You know, it was a third of the stock in 1980. It's now about 16% in England, but in the States, it's just not there. And you're having to work entirely with private landlords, and you're having to respond to that market. And so you're offering effectively a housing management service. You're saying, okay, private landlord in New York or wherever, you count the rent, you don't do anything else. You don't have to worry about a thing. Any problems at all, we'll handle it. And you know, you're bringing landlords on board on that basis. Even that element is quite hard to fund in the UK context, because you're struggling to get, you know, a small team of support workers together. I mean, the other thing that happens in the UK context is they're not typically very big. Because there's not that much money and it's not that certain. The exceptions come much later on when housing first is already starting to spread, when central government in England supports 3 pilot projects, one which is in Manchester and another in the West Midlands, and I've forgotten for the minute where the third one was.
Liverpool,
Liverpool, yeah, no, that's
region,
it.
after we did the
Yeah, and
study.
that's the only time it. So I mean, I'm not familiar with those apart a bit from the Manchester project. You know, it's the first time it operates at any kind of scale, and it actually has more resources. So it looks more like a bit more like the kind of services that it's based on. But again, the funding's temporary and they have to reapply, and it's still not as much. So, I mean, I've got, you probably won't be able to see it on the camera. I've got a little Housing First Italia thing behind.
Yes, yeah, I can
Yeah.
see.
When I worked with them briefly, and what happened in the UK was much closer to what happened in Italy. So Italy, it was FIOPS, which is Italian Federation of Homelessness Organisations, the Italian equivalent of Homeless Link. You know, so like Homeless Link, but with much better food. And and
Yeah.
and they did the same thing. I mean, they because it's kind of mainland Europe, they teamed up in formal collaboration with universities and had a scientific committee that was advancing evidence around housing first and organising studies and making the case in Italy. But like in the UK, Italians were having to cobble together things from whatever resources that they could. There wasn't some big funding stream. If you were thinking about housing first in France, in Denmark, in the Netherlands, there's big, reliable sources of funding where you can plan, you can think, and you can operate at scale, and you can think strategically. Whereas here, it's much more difficult. And still here, I mean, we come on and talk about this maybe under another question, but there's still a problem with kind of system integration with housing first here.
Absolutely. And you know, that kind of, yeah, I suppose sort of thinking you started to touch on some of those challenges in the UK context. So let's just roll with them for a moment. I mean, you've touched obviously on the amount of money for commissioning. You've touched on the fact that, yeah, we do have some social housing, obviously, compared to, say, the American context, but obviously there's been huge pressure on that, hasn't there? Especially on the 1-bedroom properties in some parts of the country that people need. And yes, whilst there are often those other services more widely, that it would be probably wouldn't make sense to completely duplicate within a housing first model. Nevertheless, those services have been hugely stretched over the last 20 years given austerity, and this is a group that faces multiple barriers in accessing a lot of that, unless, as you say, you've got a specialist dual diagnosis nurse in your kind of local area. So I suppose just thinking, you know, thinking about those challenges, you know, what impact has that had on the development of housing first, would you say? Where has that led us to, that very, very different and very challenging context that you've described? What's the impact of that been?
I mean, particularly in England, there is a deep strategic problem with rolling out housing first. And that deep strategic problem is partly because of the state of everything else. So we were working just recently with a project in the rural area where there was effectively a kind of 2-year wait to see a psychiatrist, which means effectively there's no service.
Yes.
And that kind of thing of, it's not actually there's a particular issue around access for people experiencing homelessness to NHS and adult social care, is that there's just a general shortfall. And it's everywhere. It's mental health, it's social work, it's adult social care, it's dentistry, it's addiction services, it's chiropody, it's all the stuff that it's just difficult to access. The idea that it's going to be weeks before you can see a GP, and if you have to go through the NHS, so that creates a problem. I mean, the commodification that turning housing into a product rather than a right, and in hyperinflated housing markets. It's a huge constraint on something that uses housing.
Yes.
So when we've been looking at Housing First as working a bit with the City Council in York around its homelessness strategy, something like 1% of the private rented sector is affordable to somebody on benefit, and that includes working households that can claim their housing element or claim housing benefit to top up the rent payments. There's just nothing there, and obviously then the social housing stock is under gigantic pressure, so that most of the UK is very expensive in terms of renting or buying your own home for most people. I mean, we're a very, very divided society. So, we've got a few million people with more than one house, but we've got sort of 40–45% of the population that's never going to be able to afford to buy because it's just completely out of reach. So that general context is challenging. I suppose the other thing is this thing about that it's still, because they're small, because they're very often small, because they can often be ephemeral, because there's already been examples of ones that have collapsed.
Housing First schemes.
Because the money's disappeared. I mean, sometimes it was because there was kind of pump priming money and somebody set something up and then the priming money ran out and it went. Or a local authority suddenly couldn't afford to commission it or put the service out to tender at 30% less than it had been providing. They'd been paying the existing provider, or even less than that, and so services weren't able to stabilize, and they weren't big enough to kind of have a big footprint. So collectively, Housing First is very thinly spread. It's like butter over too much bread. It's there, it's everywhere, but it's very thin. And that's a UK problem. That's a European problem as well, for the most part, in those countries where there's not been a national strategy that's trying to underpin it. Now, this isn't UK wide. There's more focus in Scotland. It looks like there's more focus in Wales, and there's going to be in Northern Ireland, where you and I have got another report coming out fairly soon, haven't we? So I think
finish.
So I think there's that's the problem, is it's too thin, and it's not big enough, so that it means quite often Housing First is there, but it's kind of maybe not part of a standardized pathway.
Yes.
Within homelessness systems. So there are exceptions to that rule. One of the most important ones is London Borough of Camden, which, going back ages ago, started to use Housing First in a very particular strategic way. So it said, okay, who's stuck in our hostel pathway? Who's stuck in our existing staircase type system? Who keeps reappearing in it without their homelessness being resolved? So, who's forgive the terminology, who's a frequent flyer, revolving door person, who's a person who just is there and doesn't get moved on out of homelessness. Let's target those people with Housing First and see if that improves our outcomes across our hostel pathway and provides a solution for people with multiple and complex needs. I'm surprised that model's not more widespread, because it was really quite successful as a way to intervene. And and Housing First, from a very small start, from like 10 people service, got bigger and bigger in that context. I mean, because you're talking about kind of 20% of the lone adult homeless population that are going to have these kinds of needs, you're never going to have massive Housing First services, because they're a part of a relatively small population. But even getting to the point where, so probably a city like York would need something like 60 places.
Yes.
On an ongoing basis. I mean, based on we've got data on York and what the size of the population is. We're not there yet.
No, and of
Um,
course
yeah,
the places that are there get filled, don't they? I've had lots of
yeah,
conversations, done pieces of strategic work in local authorities where there is a housing first scheme, but because
yeah,
it's got 30 places, say, and those 30 places are all full up, there's never an available space. People have kind of almost forgotten about it as part
yeah,
of a strategic solution, really. It's just, oh yeah, well that's over there, but they
yeah.
never have a space, So really difficult, isn't it? And you can,
Mm,
although, it was interesting when you were talking earlier, those kind of commissioners going, yeah, but how long are we talking here? How long do
mm,
people actually need a housing first
yeah,
intervention for? Let's call it 2 years as a shorthand. But I can really understand why, when they're in a service where there isn't necessarily throughput, it's very difficult to kind of, unless you've got an almost
yeah.
unlimited budget, to kind of keep expanding it to the point at which it can have that kind of strategic impact. It's really challenging, isn't it? How you scale up to that next stage with it.
Yeah, and because we're not there, we've not dealt with another fundamental strategic problem, which is the kind of difference between stock and flow.
Yeah.
So, because this population of multiple and complex needs individuals get stuck in recurrent or sustained homelessness, they pool. You
Mm.
know,
Mm.
services. The expression in the 90s was services would silt up. People were very sensitive back then. And would be, the host. It wouldn't be, the back then it wouldn't be the Housing First services, but the hostel was full up because people didn't move on from the hostel,
Mm.
or the same people kept reappearing in the hostel. We're, in a context where we don't have Housing First operating at scale, it's difficult to understand what the ongoing problem is. So if you've got, say, again, the example of you've got 60, 70 people in that population, and you've got, I don't know, York finds uranium under the Minster, and there's suddenly lots of money, um, and you house all those people, you're then in a position where you can say, well, okay, well, let's step back. Let's look at what this population is like, what their needs are like. Do things like, well, let's understand more about their trajectory. How did they get here? You start thinking about, prevention's become a massive part of the UK response to homelessness, particularly, starting in Wales, but now in England. So are there ways we can stop them appearing in this population to begin with? And you do that, and if that's the housing first, good idea. But if you can prevent people getting into that position to begin with, and we know something about, homelessness is basically caused by poverty in terms of general experience and deprivation and housing markets. But in terms of this particular group of people, we know it's about systemic problems with mental health. We know it's about systemic problems with adult social care. We know it's about, increasingly we're aware that there's issues of neurodiversity and
Trauma.
ADHD and things like that. Yeah, and obviously addiction.
Mm.
So there are points at which you can stop, and we know that there are certain populations like that if the child protection system so much as brushes up against you as a kid, the chances that you become homeless as an adult, as a young person, are astronomically higher. Same if you're a particular kind of, you keep getting if I mean I've had it explained to me, if you're a rubbish criminal, so if you're very bad at crime and you keep getting caught, so you've got an addiction problem and you keep nicking stuff from shops and doing other things, and you get caught constantly, and so you're always doing short sentences, you know. You're probably in quite a mess. There might be mental health issues and things like that, and you're much more likely to enter into that population as well. So we know there are points at which you can intercept and reduce the flow into homelessness, so that if in an ideal situation you'd have quite a big housing first intervention to begin with, you tackle everybody who's in that high cost, high risk, long term repeated homeless population, and then look more systemically at what's happening. You'd still need some housing first, but you might be able to scale down over time, particularly if, and this is what the Finns did, you start to up the prevention and you start to up integrated systemic responses, so that in the Finnish strategy, health, adult social care, they call it social services, addiction, mental health services, social landlords are integrated into the system, and it's highly preventative, so that you're bringing down the population that you've got, but you're reducing the flow in at
Yeah.
the same time. Now, of course, the other problem is you need somewhere to put people, so you have to do something about the housing supply in order to do that. So the Finns start to build dedicated social housing as part of their strategy. The Irish national strategy, which I also did some work on fairly recently, same thing. So the Irish have said, okay, well, we're going to move towards a housing first response, but we're going to create a supply of 1 and 2 bed social rented flats, so that we can operate those systems. But the problem in the UK is just, I mean, compartmentalization, silos, whatever you want to call it, things are just not joined up.
Yeah. And this kind of straddles a number of departments, agencies, directorates. I mean, it's become, I guess, come very sort of focused within MHCLG, within the kind of housing directorate. But,
Yeah.
some of the work we've done together has kind of flagged up the fact that actually other organisations aren't as strategically involved as they need to be in all of this, are they? This isn't something just for like the homelessness
No,
team
I
to kind of
mean,
resolve, is it, single-handedly? This is a multi-agency project, isn't it?
and housing first can running a housing first project can be like being in the middle of a minefield, because there's multiple things that can blow up that are not to do with you as a service provider and not really to do with the individuals that you're working with, but it only takes one of those things to go wrong. So the Job Centre Plus, the DWP, doesn't recognise your needs, doesn't recognise your situation, starts doing things like issuing sanctions, denies you PIP, all of that kind of stuff, and then suddenly there's a huge problem. You can't find the right housing, and people get stuck in, supported temporary accommodation or supported emergency accommodation, which is not really what Housing First is meant to do. And I've looked at services where that's 6-9 months, not 6 or 9 weeks.
Oh, well, we looked at one in
That's
London where it was 18 months before
yeah,
people were getting I mean, they were in a series of perhaps longer term temporary accommodation for some
yeah,
of the time, but, it was taking, a year and a half to get the housing that was supposed to come first, so
yeah.
really challenging.
Yeah,
Yeah.
and then all the other stuff, addiction, mental health, social work, adult social care, any bit of that doesn't work.
Mm.
Either things are going to go pear-shaped in terms of the support package, the exit for homelessness for that individual where it's gone wrong, or what happens a lot is the Housing First service tries to compensate and gets more and more overstretched with every person it's working with. So that and you and I have seen it around multiple and complex needs, where it's starting to, sometimes functioning as effectively a palliative service because there's nothing else, and because they've got nowhere to refer people onto. I mean, it's kind of both ends of the scale. So, if you're in some European context, I mean, if you're in Denmark, there's Skaverhus, which is basically small sheltered housing units for people with high and complex needs, including people experiencing homelessness. And if they need to become too complex, or it becomes too dangerous for Housing First to look after them because they need to be monitored, essentially. They're either very poorly, or there's a very high risk of overdose or suicide or something like that. You've got somewhere to put them, but we don't have that in the UK. And equally, when somebody doesn't need Housing First, and again, you and I and Anita have looked at this, the only response quite often is that they still have support needs, but Housing First steps way back. It doesn't stop working with them. And okay, we were seeing you for 14 hours a week. We're now going to see you for half an hour every 2 weeks. But there isn't a way of stepping down and saying, well, okay, we've got this affiliated service that's a lower intensity model that you can work with, and that means, when people, in inverted commas, their situation gets better, that they improve through Housing First, you can't easily free up that space. And when their needs become too complex, you can't easily free up that space. So you've got this. I mean, it's a constant problem in UK homelessness services. You can't move people about because
Yeah.
you can't, there's not the housing to put them into.
Mm.
But very often, there's one or two, there's not a huge range of service options available because the homeless sector, as you and I both know, is smaller than it used to be. We've seen vast amounts of money come out of it since 2010. And we've known for decades now that the statutory systems are overloaded and they struggle to cope with low homeless adults, and actively try not to engage with them, which is why we have a kind of single homelessness sector, and it's because local authorities just don't have the housing to put people in.
Yeah,
And it's very frequently a problem. I mean, and it's almost everywhere. It's not everywhere. I mean, there are places in the UK which are
only just. I mean,
yeah,
it can be,
yeah,
even parts of the country, like we've just done some work in the northeast, haven't we? I mean, there are
yeah,
bits of the northeast that are more affordable from a housing point of view, but it's quite surprising that, some of the big cities aren't anymore, are they? It can be just as difficult to get a one-bed property in Newcastle, for instance, as it is in,
yeah.
bits of the south, really. It can be really challenging, can't it?
Yeah, and a lot of the UK is like a lot of the UK is towns and cities like York, where relative to what people earn, I mean, York's kind of expensive anyway, but relative to what people earn, it's very expensive
Yeah.
because of the nature of the labour market. Because somewhere like York, okay, it's you're going to be in the catering and in pubs in the tourist industry because that's where most of the jobs are. But I mean, more generally, more and more work is not very well paid, part time, casual, 0 hours contracts, all this stuff, and um, if you're not in the kind of employment where you're more or less guaranteed a quite high income, that's more and more of an unusual experience now.
Yeah.
And I mean, it's some of the particular challenges around kind of, when people talk about, I mean, theoretically, somebody using Housing First could end up with a job, but that job might not be a job that actually enables them to exit from a situation of precariousness and poverty. And they
Yeah.
might be more precarious than when they're on the benefit system. But of course, then the benefit system, unless they're on PIP, probably doesn't pay enough for them to live on and sustain themselves for a long amount of time. So
So loads of kind of structural challenges there. And so I suppose just kind of reflecting then on moving us into sort of where next, really. It's been really interesting to hear some of your reflections from other countries. And particularly struck by the kind of piece around, we need to not only step up the scale of Housing First, but really step up our efforts around prevention. Been really interesting to hear about the kind of steps taken in Denmark to create a kind of move on those kind of places in the system that people who perhaps are Housing First clients can move to if as they age in place and perhaps their health issues worsen. So it feels like the start, and obviously, talking about Ireland and Finland's attempts to, really invigorate their dedicated social housing supply for this cohort. It feels like there's
yeah,
lots of really important ingredients there.
yeah.
Talking then about, what should happen in the UK context in your mind, just sort of bringing that together. What's needed? Where should we go using all this learning and evidence from elsewhere?
I think I mean, we've been down this road before with supporting people, which kind of collapsed when government realised how much it was going to cost to have a proper supported housing sector. And in the UK context, supported housing means both fixed site provision, but also kind of scattered housing with mobile support. I mean, there's not been a commitment towards that. I mean, it's like the policy mess around adult social care. It's something that successive governments have not wanted to tackle head on. Because as soon as you started to kind of pick at it and analyze it, the costs that would be associated with fixing it are seen as kind of politically unacceptable or difficult to sell, and they're a big commitment. I mean, you wouldn't need to spend, relatively speaking, very much to have a national housing first strategy which set standards, talked about systems integration, talked about how a homeless strategy should work and where housing first should sit within that, how prevention should work in alongside housing first, what the role of fixed site services is, because as you were saying earlier on, yeah, UK fixed site services are often pretty effective.
So like sort of hostels, supported
Yeah,
housing, that type of, yeah.
because the stuff that was kind of revolutionary for housing first in the States, which is harm reduction, consumer choice, and then more innovation like trauma-informed environments and so on, that stuff's got rolled out quite fast across those services, so that they're quite different from the stuff that Housing First was initially compared to. Now, I mean, they've got limitations, just as Housing First has got limitations, but thinking about, well, okay, what's the service mix? Where does Housing First fit within that? Then all the obvious stuff about, well, okay, we need buy-in from adult social care, we need buy-in from the NHS. That might sometimes mean that there are small numbers of dedicated medical and social work and adult social care professionals available within a multidisciplinary team, which is something else that you and I have looked at in a couple of contexts around developing those sorts of responses, which are kind of like a strategic level version of the ACT model that the original Housing First had. But you don't have it within the service, but you have it within the city, that there's this multidisciplinary team for this high cost, high risk, multiple and complex needs group of people at risk of long-term and repeat homelessness. It's frustratingly doable.
Yeah.
I mean, particularly in a context where we see massive misdirection of resources. The temporary accommodation bill in the UK, in England, is just absurd. Into the billions. Where it'd be much cheaper to house people than to put them into temporary accommodation. And we know already that allowing homelessness to become a long-term or repeat problem on a kind of per capita cost is absurdly expensive to the public sector compared to having a systematic intervention like Housing First. I mean, I think there's politically, culturally, it's a hard sell. Going back to this thing of the way in which politics, media, and mainstream society thinks and talks about homelessness, which is, you can say to people, oh, there's 165,000 kids in statutory homeless kids in temporary accommodation in England at one point. But you say homeless, and the thing that pops into their head is lone male, rough sleeper in his 40s with addiction and mental health problems. It's probably a bit criminal, and it's very hard to move the discussion beyond that, despite what the evidence says, because very often in the world, the way we live in the kind of time of bad kings at the minute, but very often the way in which narrative is more powerful than data, and homelessness is a good example of that. So selling something like Housing First is a hard sell, because it basically goes back to ideas of undeserving, itinerant poor, people who've done it to themselves. And a lot of the narratives that there still are in mainstream politics are still in that place. The initial response of the Thatcher government when rough sleepers first spiked was to try to arrest everybody under the Vagrancy Act. And of course it didn't work, because you arrest them, they've got nowhere to go, you let them go, and they reappear. And also, the Metropolitan Police said, actually, there's murders and drug dealers, we'll just do that. So I think it is a hard sell. I mean, in Finland, the sort of right-wing press started calling Housing First bottle first, because it let people keep drinking in the first instance. I mean, it's not something that's particular to us. There's still this kind of thing of well, these people did it to themselves, they don't deserve it. So that's a big hump to get over.
Yeah, yeah.
There's a ton of momentum in existing systems that makes them hard to steer. They're very, I mean, they're like, they're like oil tankers.
Mm.
Getting them to shift, even at the level of an individual local authority, is a major thing, because as soon as you're talking about altering systems or adding to systems so that the needs of, in this instance, they're small, they're expensive, human in a financial sense, on a case by case basis. But I mean, there's not many of them,
Yeah.
and reorganizing yourself, providing specific provision, developing a new strategy, all of that stuff, when you're also dealing with an aging population, with more and more economic disconnection of young people. There are a lot of bigger problems at the same time. So that doesn't help either.
Yeah.
So I mean, it's probably lessons. I mean, I've worked a bit in Ireland, and the way in which the Irish homeless sector has been able to keep homelessness up in the news and shift the narrative a bit around it has been important in terms of selling the idea there. So there's all these kinds of things. I mean, it's the basic problem is one of political will. And
Yeah.
if you look at why the Finnish strategy worked, half the answer is it's just good politics.
Yeah.
It
Yeah.
was just building coalitions, making the case, bringing government on board, and a bit of a softly approach in Finland.
Yeah. Yeah.
They started just assembling things. I mean, I met Peter Fredrickson and New Hakkinen and worked with them a bit, because they were the guys that actually did this and worked behind the scenes. And it was quite subtle. It was softly. That's difficult in the UK.
Yeah. You've
Because
got to
quite
kind
often the dialogue between the homeless sector and government is the homeless sector screaming, "What the bloody hell? What have you done now?" You
yeah.
know,
Yeah.
so it's a different set of approaches. But I mean, it's a hard sell, because there's this politics, because there's these other constraints, these other pressures, because there's resource constraints. Um, and if you try any one technique, if you try and go, we've tried this is more effective, here's the data technique. And one response is to say, well, if we just get better and better and better evidence, they'll listen to us and they'll start implementing all these services. Well, no, they won't, because governments
Oh, is
at
that
best
right?
listen to evidence that they want to listen to.
Yeah.
I mean, and at worst, I mean, it's happened in Finland since 23 with the change of government there, and elements of the far right being into their government, who started hacking away at the Finnish strategy, and so I mean, still from a very low level, but numbers have started to go up in Finland because there's been these cuts. So it's difficult to win that argument. So I'm not sure how far you can go down the data route, how far you can shift the narrative. Um, I think probably the strongest argument in terms of my own experience has been when I've done stuff on cost. That seems to land home when you're saying these
Yeah.
people are going to cost you a lot of money, and here's a better way of dealing with this, and you won't have people stuck in the system. There are different ways in which you can respond to homelessness.
Yeah, yeah, and it strikes me actually, just kind of linking back to where you began your description, I think, of how it all kind of started in America, around people coming out of the psychiatric system, actually, and Housing First being a response to them, which obviously is something that's been much more prominent within the French Housing First system, hasn't it, around needing a psychiatric diagnosis to be part of that. And it just strikes me, I mean, we've just done a piece of work looking at mental health specialist supported housing, and just starting to scrape the surface of some of the hugely inefficient spending that's going on from an NHS level, in particular, in relation to psychiatric system. I mean, wards are
Yeah.
overloaded. They're spending an absolute fortune on often really unsuitable, out of area, expensive placements for people. There's people sort of, again, who've been in, what's supposed to be transitional supported housing placements for 10 years, and it's not clear where they could move on to, so we're seeing that kind of, and it's interesting because obviously Housing First in the UK has ended up, certainly over the last kind of decade, being much more lined up with our rough sleeping response, hasn't it?
Mm.
I almost wonder whether there's sort of actually, Housing First might come in round a slightly different door, perhaps in the UK context, whether maybe there are more
Mm.
clear kind of cost effectiveness savings on the kind of psychiatric kind of angle, really, and what that might look like. Because we know there are so many people in the hostel system, in the homelessness system, who do really or should have a psychiatric diagnosis. I just wonder whether there's whether there's a sort of different sort of focus for the movement in.
Yeah, I mean, the origins of it were mental health. So, like I was saying, so Housing First was derived from the American long stay psychiatric hospitals, the asylums, closing down and going and starting off with this kind of staircase approach, and then going to something that looked like Housing First. And then Sam Sempris comes along and looks at this. We provide them with housing, and we provide them with multidisciplinary team, and adapts it. But it stays a psychiatric intervention in the US. And the reason it stays a psychiatric intervention is because the only way you can afford to put people into it is if they qualify for a federal benefit that's associated with severe mental illness. So, because of the way the American benefit system worked when it was set up, they had to have a diagnosis, because if they didn't have the diagnosis and they didn't qualify for this federal benefit, you didn't have enough revenue to operate.
Mhm.
So it stayed a mental health intervention.
So,
Um, in Finland, lots of people with mental health problems, but they just had a different working definition. It was simple as that. Strategic level, they just said, right, the problem is long-term homelessness.
mm,
So ergo, we target long-term homeless people who, by the way, tend to have multiple and complex needs, one of which is frequently mental illness plus addiction and so on. So just a kind of small definitional shift meant that it was a much broader intake. The French system is a mental health intervention,
yeah.
and it's the equivalent of the NHS funding it.
Mm,
That creates huge strategic advantages because it's part of the health system.
mm,
And homeless interventions, even a program like Housing First, in terms of public health system, is a couple of euros lost down the back of the sofa in terms of overall health expenditure. What's massive from MHCLG perspective is three peanuts if you're
yeah. Yeah.
Department of Health and Social Care. So if you can get health engaged and you can make the case to health, that gives you a stability and access to resources that you don't have as the homeless sector. But there's problems that flow from that. First problem is, what happens to everybody who hasn't got a formal psychiatric diagnosis? Where do they go, and what's the consequences down the system for that? The second is the evidence from a clinical perspective,
Mm,
where Housing First is a really difficult sell because it's not a consistent intervention. And from a health science perspective, and health economics perspective, it's a very vague intervention,
mm,
because all their systems, all their logic are, you do this, you
mm,
do this drug rather than this drug, and
mm,
what happens? And you
uh,
say match populations, okay, well, we're going to buy this drug because that's better than this drug.
yeah. Yeah.
But it's far more complex than that, and far more kind of human than that. And health systems, it's mechanical. It's blue pill, red pill stuff.
Yeah. Yeah.
In terms of which one are you gonna give them, and that's how NICE works. That's how the NHS evaluates whether or not it's going to spend money on a treatment. It doesn't work in a way that's suitable for that kind of health science. And then I had the conversation with health scientists, and well, can we do this? I mean, I've literally had the conversation with health scientists.
Yeah, yeah,
Can we evaluate this? And they'll just go, "Well, this is all over the place. What is this?
yeah,
It's not even consistent. How
yeah, yeah.
what's your intervention? Because it's it's
So relational, and
yeah,
I guess
it's
yeah,
yeah. And things like it's hugely dependent on context, on access to other services, and what the housing market's like. So there's just so many variables. It gets very confusing very fast.
tricky.
Um,
And I think that brings us very nicely, just for the last couple of minutes, to a
mm,
plug for our Fidelity framework, which you did touch on briefly
mm,
earlier on, because of course, yes, it is kind of vague in a sense, but
yeah,
at the same time, there is a really important kind of structure around its value base and, some
yeah,
key kind of principles around how Housing First
yeah,
is delivered.
yeah.
Do you just want to say a few words about,
Yeah,
about
sure. To be specific, it's vague if you're a health scientist. It's not
yeah,
necessarily vague if you're somebody else. It's vague if you go, right, the intervention is exactly this,
yeah,
it's applied consistently.
yes.
But no, Fidelity's been a challenge.
Mm,
Um, it's been a challenge in terms of things went wrong in the United States because there wasn't clear guidance and a clear framework about exactly what Housing First was. So what happened was when the George W. Bush administration said, okay, this is evidence-based, there's now federal money.
mm,
But you didn't really have to do anything more than call yourself Housing First. So, it's like the sign got scribbled out and Housing First got written on it instead. And I mean, when I've been explaining this to people, I always use the example of it's kind of like Spartacus or Life of Brian. So what happened was, yeah, I'm Housing First, I'm Housing First, I'm Housing First, and so is my wife. And so the model got hugely confused and diluted, and it could be very easily attacked because it was all over the place.
mm,
You know, so people wanting to defend the previous systems, residential treatment, staircase systems, behavioural modification, housing ready models, could pick holes in Housing First because it was all over the place. They're saying, well, this project's not the same as this project, not the same as this project. So Housing First in the States, and Sam Decembris in particular, tried to reorganize and promote fidelity and promote consistency to defend itself against that. But it was a bit. The war had already kind of started. It was a kind of trying to counteract something that was already very embedded, and the kind of variation and problems of inconsistency had already happened. It was very important we didn't replicate that mistake in the context of Europe, in the context of the UK. So I mean, the stuff I did with 10 years or more ago now with the Housing First Home Europe and Fienza was with the awareness of what happened in the States,
mm,
and that you've got to be clear what you're doing in terms of ethos and the key principles of Housing First if you're going to expect it to work.
mm,
So, I mean, I was trying to explain this challenge in a European context, and I used the example of what would horrify many Europeans, which is tin spaghetti, so like tin carbonara, which find it in Tesco's. You
yeah,
just kind of, oh my God, you're Italian and you see that.
with you.
What the hell is that?
Yeah.
That's the thing to avoid
Mm,
is, as soon as something is Housing First style, as soon as it's not ticking to the key things, and the key things we've been talking about throughout this kind of conversation. So you're not making people housing ready. You're not trying to promote behavioural change. You're trying to create a collaboration with that person that provides them with a stable and sustainable route out of homelessness. You're saying the same from the first. You've got a right to housing. You've got a right to control over your own life. You've got a right to be respected. Um, all of that kind of stuff, which isn't so much of a kind of sea change in the UK context, because like we're saying, a lot of our other services were well down that road by the time debates around Housing First started, and I've been to Canada, for example, and yeah, there's Housing First, but everything else is like down and out in Paris.
Yeah,
I mean, it's
yeah.
yeah, you've got Housing First, you're qualified for that, you get into that, but I mean, there's the rest of it is yeah,
Mm,
early 20th century, um, not dangerously close to almost kind of workhouse
yeah,
type models in terms of response. And there are places, the predominant homeless service in Europe is an emergency shelter,
yeah.
even now. And so there's still this problem of kind of shifting that narrative, shifting towards things and saying, well, A, this can work, but B, immediately providing this explanation as to how you need to do this. You need to think in these terms, you need to organize in this way, you need to deliver in this way, and then it will work. It's
Yes.
no good. I mean, that's where the fidelity is fundamental because it's no good saying to people, you should do this, and then you don't explain what you mean in very straightforward ways. So terms of, I think the next step is probably kind of a strategic fidelity framework as well as a service fidelity framework to think about how to get it to the point we need it to be. Um, but yeah, the fidelity stuff's fundamental to making sure that you're actually delivering the thing that's going to be more effective, and that you're really starting to make a dent in high and complex needs, multiple and complex needs in terms of long-term repeat homelessness. Because if you don't implement it in the right way, and historically, as you're more familiar than I am because all the stuff you do at local authority level, the degree of inconsistency between what is nominally the same type of homelessness service is just unbelievable, and it's because everything was never really orchestrated or organized nationally. There was never kind of a set of standards as to what a hostel was or what an emergency shelter was. And so they're all over the place. And
Yeah.
if anything, localism made that worse in terms of those inconsistencies. So I think, the homelessness sector isn't in need of guidance in the UK. I mean, if you, like I was saying before,
No.
you look at what Homeless Link did, you look at what the Housing First England did, you look at what Crisis and other people have done in terms of saying we need to do this around Housing First, and in terms of talking about integrated strategy in a much more advanced way than any government has so far done.
Yeah.
Um, they don't need that, but on a smaller scale, individual providers, local authority commissioners do need that kind of framework.
Yeah.
So that's what's important to do that kind of stuff.
Absolutely, absolutely, and we'll no doubt invite Anita to come on another day and talk a little bit more about the sort of operational management considerations in making that kind of service happen. But it felt like a real, a luxurious opportunity to bring together our different kind of insights into thinking about what those kind of building blocks are. Wow, lots to think about, and yeah, loads of interesting questions there around kind of what that kind of housing first national strategy might look like, whether we're going to get one, so on and so forth. But thank you so much, Nicholas, for sharing all those insights. It's been great to hear some of the sort of origin stories and the contrasts between how it's developed in all these different countries that you've had experience of. Really, thank you very much for coming on and sharing all of that. Really good to talk.
Thanks very much.
Thank you.